Eating healthy is a top resolution, of course, year after year, but as we all know, it's a lot easier said than done. This morning, we're joined by Mayo Clinic dietitian Jamie Pronshinsky. Good morning, Jamie.
Good morning.
Thank you so much for being with us. So, New Year's resolutions can seem overwhelming, especially when it comes to nutrition. You hear so many different things, you know. Eat carbs, don't eat carbs, count calories, count macros. Conflicting information everywhere. What is like a simple place where people could start?
Yeah, I'm typically recommending that people start with small changes, as these are more sustainable. I think a pitfall is people try to focus on too much all at once, and that's overwhelming, and they give up. One small change that I often recommend is people work on increasing their intake of fruits and vegetables. It's a small change, yet really impactful. These fruits and vegetables are very full of nutrients, and they're low in calories, which can help us eat healthy, yet stay within our calorie goals.
Nothing too crazy either.
Right.
Something people can reach for pretty easily at the grocery store.
Exactly.
Okay, great.
Any other pitfalls? You addressed one. That was the first thing I was thinking. Easier said than done, kind of, but you answered part of that. But any other pitfalls?
Yeah, I think I'm recommending that people avoid diets that are like overly restrictive, too few calories, or exclude entire food groups.
Okay.
These diets usually don't have enough calories or nutrients for good health, and any weight loss that we might see on those restrictive diets is typically regained once we stop those diets.
Harder to stick to too, I'm sure.
Right, yes.
Okay. So now we're a few weeks into the new year. Some people may have, you know, had plans to start eating healthy this year. Maybe they've been derailed already. Maybe they're thinking they'll start next year. What's your message to them?
Yeah, I think it's never too late to start, you know, healthy eating, good nutrition. It's a marathon, not a sprint.
Okay, great. So get started. It's okay. Get back on the wagon.
Right.
I hear so much about a lot of people recommend cutting sugar completely out of your diet. That seems like, I mean, yeah, I'd like to, but is that even doable? I mean, that's outrageous, really.
Right, and I think those aren't sustainable or realistic changes. Maybe just less. I think it's important we eat our favorite foods, but in moderation, right?
Cheat days, maybe in moderation, too.
Yeah, you know, when people tell me they have cheat days, I think
Yeah.
their diet pattern is probably too restrictive. If we need cheat days, then I think we're not eating our favorite foods often enough to make that a sustainable diet approach. And I think the idea of cheat days tends to lead to that all or nothing thinking, right? Like we're either on plan or we're not. And I don't think that sets us up for a good, healthy relationship with food either.
Right, right. You know, some people, maybe they're doing cheat days once a week. So if they are, then you maybe add some more things back into your everyday diet.
Less restrictive, yeah.
Okay, okay, great advice there. We're seeing Ozempic, Wegovy, Mounjaro kind of everywhere in the media.
Right.
What are your thoughts on that? Should people be, you know, beginning of the year, trying to get a prescription to that to control their cravings? Should they try it themselves? What are your thoughts there?
Right, it's like you can't look anywhere and not see a commercial for a weight loss medication, and I think they can be very effective tools in addition to diet and lifestyle changes. And I think, you know, it doesn't replace healthy eating and exercise when we think about the health benefits. And if you're considering a weight loss medication, certainly talk with your healthcare provider to make sure it's a safe and appropriate option. And with weight loss medications, see if you can work with a dietitian so we can assist you making those diet and lifestyle changes, not just for weight loss, but for overall good health.
Okay.
Some catchy jingles with us. Medications too. That's one of the first things that popped in my head. Oh, that's a good way to reel you in.
I am thinking of one right now. Yes. All right, Jamie. Well, thank you so much for joining
you.
us this morning.
Absolutely.